What we are doing with this young chap here. So this guy is having a lesion or a growth in his lower jaw. Very unfortunate that you can see from the front profile, if you can zoom in and see that he's having a sinus here. So this part of his lower jaw is involved with a tumor or a cyst, we don't know. So we are going to do a excisional biopsy. That means we are going to take out the involved part of his lower jaw and send it for examination. So this is a curative surgery that we are planning to do for this young chap here. So he's just 9-year-old. So we are going to give anesthesia from his nose so that the boy is going to sleep during the surgery. He will have absolutely no pain. Also, he's having this issue involving his teeth. So we are going to knock off his teeth involving this lesion, so that we can help this guy to get cured from this disease. So Amada, so if you can see, he is having some decayed teeth that is there, which is the root cause for this lesion. So this could be a dentigerous cyst, it could be a odontogenic keratocyst, or it could be a ameloblastoma. This will be proven after the biopsy or a histopathological examination that we are going to send the specimen to a lab. So right now the boy is in the operation theatre complex. So this surgery is involving, as I said, we are going to do all the surgery from inside of the mouth. We are going to knock out the teeth, take out the lesion, the lining, everything, the diseased part, and also this lesion we are going to remove it. There is a sinus tract. With this tract is involving the skin to the jaw. There is a connection. So we are going to disconnect the connection, remove this entire lining, so that this boy will be free from this condition. So we are now shifting the boy to the operation theatre. We will come up with the follow-up videos. cavity that we have enucleated. You can see, so this is the nerve. So we have preserved the nerve and also extracted the involving tooth around. So the huge cystic cavity, complete enucleation has been done. So this is immediately after enucleation. So now this is immediately after closing the huge cystic cavity. We've got a watertight closure there. You can see good closure of the oral cavity. Just advancing some buccal mucosal flaps and also gingival flaps. Thank you. So today is day 3 following his surgery. So it's very sad to see a boy with the tube and all that, but unfortunately he had a very huge tumor or a cystic lesion. We don't know. We have sent it for a biopsy. We'll get to know in another 2 to 3 days. So everything is done from open mada, hamada, from inside of the mouth, so that there's no big cut or anything from outside. So everything is healed up. It's healing, and there's some sutures inside, so we don't want him to take anything orally so that the wound gets dirty or infected. So everything we are giving through the tube so that the healing takes place in another 2 to 3 days. So once all the sutures, all the wound inside the mouth heals up, we are going to remove this tube in another few days. So these are the pressure dressing to avoid swelling for this young boy, the brave boy. So today we are going to remove this pack and put some stitches where he had infection in the skin which was extending to the wound that is inside. So we're gonna close that up, clean up everything so that this boy gets rid of this condition. So we're gonna come up with follow-up videos in future showing his recovery and radiographs also, so that there's no recurrence. Thank you.